Hi, this is Dr. Jimerson. I just wanted to give you guys an update. You guys know that I am very interested in breast augmentation. I do a lot of breast augmentation, and I like to attend conferences and summits, give them through the Plastic Surgery Society or different vendors to keep my skills up and to learn what's new. And so I thought I would share some information with you about breast implants. So we are in Las Vegas, and I just finished attending a Shape Summit given by Allergan. Allergan's one of the breast implant companies. That's the people that supply us the breast implants. The other one is Mentor, and also, and they're also very big in supplying breast implants. And so here's the Shape Summit. Just kind of tell you guys how this goes. So this is a little book they give us, and many of you guys might not know, but I don't do a lot of breast reconstruction, but I do a lot of breast augmentation, and I was interested in the different new shapes and styles of implants. There's essentially two types of implants. There's saline implants and there's silicone implants. And then within the silicone implant family, there are round implants and there are shaped implants. Shaped implants are flatter at the top and fuller at the bottom, so they mimic more of a natural female breast. These implants, most plastic surgeons, I would say, put in round implants, and so this summit was to get some general consensus or information for when to put in shaped implants, and so I learned a lot of ideas and about it, and it seemed like the general consensus was that for people that have low BMIs, that are somewhat thin with small breasts, like B breast, A's or B's, they would end up doing pretty well with a shaped implant. I want to give you guys some, but people with higher BMIs would, and or larger breasts would do well with the round implant. So when we are, as plastic surgeons, when we are thinking about breast implants, these are the type of questions that we want to ask you. So let me show you. This is a sheet that they conveniently made for us. So things that we measure, we measure the base width of your breast. So basically from here to here, so where your breast starts over here near your sternum, and then over here on your lateral chest. So that's the base width. We also want to know the distance from your nipple to your sternal notch, because that'll tell us how saggy your breasts are. And there's certain parameters for where we want the nipple to sit and where the normal nipple would sit in a non-ptotic or non-saggy breast. The other measurements, we want to know if your nipple's too far lateral, too far medial. We want to know the distance between the nipple and your inframammary fold. The inframammary fold is this fold that sits underneath, that is underneath your breast. And so sometimes this distance can be short, sometimes it can be long. If it's long, then we'll need to bring it up and create more of an inframammary fold. If it's short, then we're going to have to bring the inframammary fold down. So, so the basic point is that there's a lot of surgical planning that goes into creating the best breast implant procedure for you. So they presented a lot of cases. We went over a lot of topics, and then they kind of gave us a quiz, and then they put the results up, kind of like polling us on, who would do different things. And obviously there's a range of things we would do. There's not one right answer. I wanted to show you guys, the different types of breast implants. So with breast implants, there's a couple different measurements for the shaped implant, okay? Number one, we want to know the height, okay? So the height of the breast implant, because remember we're putting this in your under your breast, so we'll make an incision here or around your nipple or under your arm, and we want to know, okay, how high do we want this implant to go? Because if we make it too high, then you can see this ridge up here. If we make it too low, then there's a dip. So we want to, we want to know the height, we want to know the base width of it, and then we want to know projection. Projection is the distance that it sits out from your chest. And so those are the three measurements. But usually what we do is we start with the chest width or the base width of your breast, and then from there we have convenient charts that will help us to figure out what's the most appropriate breast implant for you. They also talked a lot about breast reconstruction. For those of you guys that don't know, there's several types of, and like I said, I don't do a lot of breast reconstruction, but I have in the past, and it's important to know about that. A lot of times, there's different types of breast reconstruction that we can do. We can do breast reconstruction with a breast implant. This usually, depending on if there's radiation and chemotherapy, what we'll do sometimes is put a tissue expander in first, and because all the breast tissue is removed, so we'll lift up the pec muscle, and we'll slip a breast implant, a tissue expander underneath the pec muscle, and then we'll expand that and expand the skin, and then once we get the pocket of the breast to the size that the woman wants, then we'll remove the tissue expander and we'll put an implant in. And sometimes we'll do fat grafting just to soften the look. There's also flaps. For instance, we could take skin and tissue from your stomach or your back and rotate it up into the breast cavity to create a breast. And this can be done by keeping it attached to muscle, or we can disconnect it from the muscle and then sew the blood vessels up here into this tissue to help it to survive. And sometimes we'll do, we'll take a smaller piece of tissue and put it up here, and then we'll put a breast implant underneath. So those are just some options. So that's really all I wanted to say about the Breast Summit. As you know, I'm very interested in breast augmentation surgery, and I keep up to date with it, and continue to follow. And if you like this video, then please make sure that you subscribe to our channel, because I'm going to continue to have more updates on different topics in plastic surgery. And so if you like plastic surgery at all, then make sure you click to subscribe. Take care.